Hi, this is Mark Ittleman, speech-language pathologist, and welcome to this blog that deals with the teaching of talking. The teaching of talking is our book that was written to help caregivers and speech pathologists learn how to stimulate speech and language at home in a very easy and comfortable way. This blog is entitled Insanity: Does It Occur in Speech and Language Therapy? Now, I've been a speech pathologist for over 40 years and have talked with many people each and every day. And many people have told me of experiences they've had in therapy where their loved one has been shown pictures and is asked to say phrases and sentences by the speech therapist, and often the individual is frustrated and has a great deal of difficulty constructing any phrase or sentence. And this may occur over and over again with many different attempts. And what happens also with aphasia is that quite often the person does not have access to all of the words in speaking. So therefore they have extreme difficulty attempting to say phrases and sentences because the words just aren't there. Occasionally they can say a single word, or sometimes more than a single word, but they're not consistent at all with the ability to express language anymore, the ability to say phrases or sentences. And so what happens quite frequently, is that these people are sent to speech therapy, and clinicians show them pictures, quite often pictures that don't even deal with their immediate environment or their immediate needs, and requested to make up phrases and sentences that they just can't do. And quite often this is very frustrating, and it's very heartbreaking for the caregiver who watches their loved ones attempt to speak and nothing really occurs. And this may occur week in and week out, the same type of therapy that does not necessarily yield the kind of results that help people independently say phrases and sentences. And so what typically happens is that the individual gets quite frustrated and anxious because they attempt to say these phrases and sentences and they just can't do them by themselves. So if this resonates with you, or if this idea sounds familiar to you, we've developed a technique that is very helpful for caregivers, speech pathologists, and the clients that you serve. The teaching of talking method is aimed at working with people just as soon as they have a stroke or aphasia, starting to stimulate their speech and language right away, but not doing so in a way that could be frustrating or cause the person a great deal of anxiousness. The speech pathologist who uses the teaching of talking is able to ask questions that can stimulate single words, word pairs, phrases, and sentences right away. See, we're not really interested in the individual independently saying phrases and sentences immediately, because this causes a great deal of frustration and it causes a great deal of anxiety on the part of the person with the speaking difficulty. So the teaching of talking stresses helping the person who has the speaking difficulty say the words and make the requests that are necessary in everyday living. Not only that, but the teaching of talking also capitalizes on the phrases or the sentences or the common expressions that that individual uses each and every day, and helps give those words and those phrases and those sentences to the person with the speaking difficulty in an easy way so that those phrases and sentences can be repeated back. And when this is done on a daily basis in an easy way, everybody feels good about it. The patient feels great about it, the caregiver feels great about it, and there's no stress and there's no frustration, because what we're doing is we're spoon-feeding speech and language to the individual who right then and there does not have access to phrases and sentences. It's sort of like working with a child or a baby. You've got to start out with single words, and then you start working on word pairs and phrases, and you do so at home in a very loving and accepting environment and a non-threatening environment. And that's what we capitalize on, helping children and adults learn speech and language again at home, and training caregivers who often have not really any clear idea what to do with their loved one. And so that's why we've written this teaching of talking, so that others can learn, especially caregivers and speech therapists, can learn to stimulate speech and language in a very easy way at home, where there's immediate success and very little to no frustration and anxiousness. And what we've done is we've written a book called The Teaching of Talking. We've put that on audible.com, so that the book is also on digital audio, so it can be played while you're around the house, or while you're driving in the car, or out and about. And we are now putting the teaching of talking and the methods on video, with sequential lessons for the caregiver, for the speech pathologist, for the student of speech-language pathology, so that they can learn how to stimulate speech and language in a fun, easy, and interactional way. Isn't that great? So, old Albert Einstein used to say, insanity is doing the same thing over and over again and thinking that you're going to get different results. With the teaching of talking, what you're going to be doing is you're going to be getting away from the photographs, getting away from vocabulary that isn't significant, getting away from worksheets, handout sheets, fill-in-the-blank sheets, and all of that stuff, and you're just going to start working on speech and language that is necessary to be used at home, to make requests, to tell the people that you love them, to let people know who you are, what you want, what you need. And that's what speaking is all about. So please, if you'd like some more information about this, contact us, and we'd be more than happy to share with you the book, the Kindle, the audio, and the soon-to-be-released videotape, which will walk you through step 1, 2, 3. This is Mark Ittleman, and welcome to this blog, and we look forward to sharing with you more information each and every week. Thank you very much.